Although the word is just over 100 years old, schizophrenia as an illness has been around for centuries. Evidence traces schizophrenia back to the time of the pharaohs, in the second millennium before Christ. Schizophrenia was first identified as a discrete mental illness in 1887. The word schizophrenia, which is derived from Greek root schizo, meaning split, and phren, meaning mind, was first coined in 1911. This image shows the brains of a well twin and a schizophrenic twin. It shows the distinct differences in the brains of someone who has schizophrenia versus someone who does not. Over the last century, major developments have occurred in the treatment of schizophrenia. In 1934, convulsive therapy, which induces seizures, was introduced. This method induces seizures through injections of camphor, which was an unreliable technique to induce seizures. Later, electrically stimulated seizure therapy, also known as electroshock therapy, was introduced in 1938. These methods have not been proven to actually help with schizophrenia or reduce symptoms, however. The following is a picture of an asylum that is now closed down. It saw a distinct reduction in patients as patient care switched from asylums to community-based treatment centers. The first drug to treat schizophrenia was identified in 1952. It relieved positive symptoms and also aided in the understanding that schizophrenia involves neurobiology. Deinstitutionalization began in the 1950s and saw the transfer of patients from asylums to community-based treatment centers. Shortly after, there was a rise of patient advocacy groups. One such patient advocacy group is the National Alliance for Mentally Ill. These sorts of groups advocate for the rights of patients and their families.